Hey, I need a place to stay and I need more medical attention. I came to this mental hospital to get some help if that is possible.
From the looks of it, there's so much work to do with so little help. We don't have enough nurses here.
I've been hearing a lot of noise throughout the day.
That's really scary. Let's get you in right away. Doctor, please bring the handcuffs.
Can I play my awesome electric guitar?
I can't provide that for you here, Deborah. You have a very infectious disease called rock and roll syndrome.
What can I say? Metal is the soul no matter how old you are, I guess.
Has this ever happened to you? According to the National Alliance on Mental Illness, 61.5 million Americans experience a mental illness.
Mental illnesses are also the leading cause of disability globally, but the treatment of mentally ill folks in institutions are still archaic. Why? Well, we have the explanation for you on why this happens. I'm Nadia.
And I'm Amber.
Together, we explain the issues that have been built from mental health institutions.
And attempting to apologize on behalf of psychology for how mental health institutions have dehumanized the patients within.
These facilities increased mental health symptoms due to the abuse of power and stigmatization towards the patients.
In the 1800s, nurse and political activist Dorothea Dix wanted to change how we viewed mental illness after seeing mentally ill people caged and imprisoned. Around 1843, the first institution in New York was opened, the Utica State Hospital. They treated mentally ill patients and focused on Dorothea Dix's moral treatment. Caring staff and comforting environments were involved.
But the financial issues, alleged fraud that led to the rapid decline of professional care, moral treatment was eroded.
The power dynamic presented in these institutions by psychologists and staff, along with the lack of funding and sympathy for mentally ill people by the public, led to abuses of power and overcrowding.
The lack of support and public education for mentally ill folks and their symptoms led to the enabling of worsening abusive treatment like the Utica cage, where patients were strapped down and forced to lay in a coffin-like device.
Patients were heavily affected by the rise of eugenics and biological views of mental illness as well. These led to sterilization, segregation, and lifelong hospitalizations.
With mentally ill patients, they were placed to be hidden from the world at the beginning, as psychologists believed it was within their nature and believed they lacked the ability to change without strict rules. These patients were the culprit for this abuse by psychology. It doesn't go without saying that these mentally ill patients were placed under these hospitals were to protect themselves and others with genuine rehabilitation instead of neglection.
Patients back then were forcibly settled into these mental hospitals, and by 1955, 50% of hospital beds in the United States were designated for mentally ill patients.
And now, with modern hospitals, they trust these institutions will deliver on what they promise to tend to their mental health.
Psychologists, therapists, and researchers contribute to the stigmatization of mentally ill people and help fuel the fire of public discourse.
Through old psychology research that built these institutions that still exist, the practices have failed to educate staff in modern and effective methods.
The modern goal for institutions now is a short-term stay and to make a mental health plan for each client. Because psychologists weren't focused on treatment but on management to avoid overcrowding, in the past, these institutions could not afford special treatment.
As 18% of unhoused individuals are mentally ill, I think psychology needs to make amends by setting a specific standard in nursing for mental health hospitals.
There needs to be extensive public education and institutional training focused on those with mental disorders and their needs.
Accessibility is another way to help those in need. Those who really need treatment cannot afford the resources to get better, and when there is public care, it isn't sufficient for certain people.
Therapists and providers should be more accepting of Medicaid and Medicare patients to help the low-income populations.
Psychology has a history of mistreatment, and that is why we provide to you all of our unique services.
With the Amber and Nadia Company, accessibility and new standards for institutions can be assured if you call us now.
With our phone number 444-444-4444. And don't read the fine print that says we will be taking all of your prized possessions.